Something has really gone wrong. The misconceptions about weight science are astounding. Suspend your preconceptions and a very different picture emerges. One where it's the machinery of weight stigma that needs dismantling. Hi, I'm Dr. Linda Bacon, and I'm devoted to creating a global transformation that focuses on body respect, not the war on weight. My work is inspired by lessons learned through 3 graduate degrees in weight science, including a PhD in physiology, as well as clinical and research experience, and having healed from my own personal suffering around weight. Let me briefly walk you through the weight health minefield. Right now, that minefield is littered with 2 treacherous assumptions. One is that fat kills. The second is that being fat will make you sick. Does fat kill? Let's look at the facts. To write my dissertation, I had to review the evidence that obesity increases mortality. And guess what? I couldn't find it. In fact, there are about 40 peer-reviewed epidemiologic studies on this topic, and all but a handful contradict the popular wisdom that fat kills. What most studies show is that people considered overweight and mildly or moderately obese live at least as long as, or longer, than people deemed normal weight. The data are a little more complicated at the extremes of underweight or obesity, so I won't get into that here, even though the practical application I discuss works at the extremes too. But understand that I'm talking about the vast majority of the so-called overweight and obese population in this discussion. Some of the most comprehensive data on weight and mortality comes from government statisticians at the Centers for Disease Control, using data from the highly respected NHANES study, the largest nationally representative cohort of US adults. Their results, published in JAMA, found that people in the overweight category lived longest, and people who were mildly or moderately obese lived as long as those in the normal weight category. They also acknowledged that, quote, "This finding is consistent with other results reported in the literature," unquote. Okay, so we don't have evidence that fat is the killer it's made out to be, you may be thinking, but it clearly causes disease. Does it? Well, let's see. If yellow teeth are common among people with lung cancer, do yellow teeth cause cancer? If bald men are prone to heart disease, does losing your hair make your ticker go bad? Of course not. Epidemiology shows us relationships, but not causality. It shows an association between baldness and cardiovascular problems, for instance, but not the fact that elevated testosterone is implicated in both. And common sense tells us that yellow teeth, like lung cancer, can result from smoking. Likewise, there are many factors that confuse the relationship between weight and health. For example, let's look at fitness. The Cooper Institute in Dallas, Texas, has been gathering data on a large group of patients, examining the question of what's more important, fitness or fatness. Their research has been providing a consistent answer to the question for 2 decades now. When fitness is considered, body mass index is almost irrelevant. In fact, fat but fit people fare much better than quote-unquote normal weight people who are unfit. Dr. Stephen Blair is a researcher at the Cooper Institute. He likes to say, "I was short, fat, and bald when I started running, but after running nearly every day for more than 30 years and covering about 70,000 miles, I'm still short, fat, and bald." I'm glad that Dr. Blair is involved in this research. At least he knows that fitness appears to be the key factor in protecting our health, no matter how much he weighs. Next, consider discrimination and stigmatization. It's tough to live in a fatter body in this culture, socially and otherwise. Think about what it must be like for larger people, that is, most Americans, to confront daily in the papers, magazines, television shows, and commercials that their bodies are unattractive and constitute a horrifying public health crisis. To hear assumptions from dietitians and other healthcare practitioners that because of a physical characteristic, their weight, they must be unhealthy and engaging in poor self-care. Everyone, fat or thin, is severely harmed by this message. It teaches all of us to see larger people as problematic and to fear becoming fat ourselves. There are few legal protections, despite well-established facts that heavier people are less likely to be hired, promoted, or make comparable money to thinner people working in the same positions, and that they received less adequate medical care. Weight bullying has steadily increased over the years and is now the most commonly reported form of bullying. Stigmatization and discrimination are known to cause stress, and stress is a risk factor for many of the diseases we blame on obesity, including cardiovascular disease and diabetes. And as an aside for anyone tempting to suggest that discrimination is just another argument to encourage weight loss, well, isn't that just blaming the victim? Of course, I'm not saying that everybody who is fat is healthy. I'm not saying that everybody is at an ideal weight. I'm not dismissing the notion that weight affects health. What I am saying is that the relationship between weight and health has been wildly exaggerated, and that by focusing on fat and weight rather than body respect, we overlook how complicated it actually is and miss our opportunity to make changes that have proven to be successful. We stand on much firmer ground when we focus on improving health directly rather than using weight as a mediator. Look for another video in this series where I discuss what really matters in good health, and another video proposing a far more effective solution than dieting, and another calling for a détente in this damaging war on obesity.